Did you know the average American spends more than 13,500 US dollars per year on healthcare? The total healthcare cost amounts to more than $4.5 trillion, which is about 17% of the US GDP. And why is US healthcare so expensive? There are many reasons, but I have synthesized five top reasons. Let's dive in. Number one, fragmented system. There are multiple private insurance companies, and when they have to process millions of claims, it leads to high administrative cost, which is also our second point. Up to 25% of the US healthcare spending is just purely administrative cost. And you won't believe the third point, which is drug prices. If you go to a pharmacy and look for a simple over-the-counter drug such as paracetamol, in other name, which is brand name is Tylenol, it's so many times more expensive than other countries. And why is that? And this is example for just over-the-counter drug. If you go to more prescription drugs and specialty drugs, it's astronomically expensive. And the reason is, unlike other countries where a country can set the prices or other agencies can set the prices, but in the United States, it's the drug companies, the pharmaceutical companies that set the price for drugs. And obviously, they want to make more money, hence, they're going to price higher. It's simple incentives. I'm not surprised by that. And number four reason is fee for service. As you know, anyone who look at the US bill or gone to the hospital, when you look at the bills, you will see the itemized bill. That means more test means higher bills, more procedure means higher bills. Hence, the system is designed to do more tests and procedures. It incentivizes it. Charlie Munger once said it, show me the incentive, then I will show you the outcome. And obviously, outcome is high expensive healthcare because there is an incentive to do more tests and procedure instead of focusing on preventative care. And number five is the malpractice insurances. Obviously, the US system as a whole is famous for its litigations and lawsuits, and doctors are not devoid of those lawsuits. Hence, what they need to do is purchase expensive malpractice insurance to be very defensive. And even while diagnosing and treating, they would have to save their own licenses and make sure, sometimes even unnecessary, order expensive tests and procedures to be very defensive. And all of these five things put together makes even the routine care unbearably expensive for average American. And every day we experience it. It's high premium, it's high out-of-pocket cost, and we rethink, okay, let me postpone visiting the doctor or get the care that we need because we're scared of it. And we delay it, we procrastinate it, we postpone it until it becomes severe, and at higher severity, we end up paying much more. And obviously, when the average age of the US population is rising, the senior citizen population is rising, who need more healthcare is going to only explode exponentially. How do we solve this thing? At present, I can say it's above my pay grade, but what I can focus on is eating healthy, focusing more on preventative healthcare, and that's where at Godsphere we talk more about how to prevent diseases, especially focusing on GI healthcare. For more GI insights, GI self-care, and also clinical navigation, please subscribe to Godsphere. And in the next video, we are going to make a video on 20 ways to spend less on US healthcare. Please stay tuned. See you next time.